My dependency did sneak up on me, and for a while I had convinced myself that I could control my use, and it seemed as though one day I couldn't. If you're doing well, it's harder to see the problem. My name is Jake. I'm a 35-year-old pharmacist from the Boston area. I've been married for 10 years. I have a 2-year-old son and another one on the way. For me, the use of opioids started when I was in college, and it was really more of a social use. My use became very different very quickly from my friends' use. I may have done well academically and been able to go back to school and get a master's degree, but my home life was not optimal. I wanted the complete absence of emotion. For me, the drive was really professionally. I wanted to get a bigger and better position and to get more money, and as I was getting those things and again continuing to do well, nothing else really seemed to matter to me. I would do whatever was necessary to get my hands on opiates, and that included betraying friends that I had worked with. One night, 2:30, 3 o'clock in the morning, I'm sitting there at a conference room table with lines of crushed up pills in front of me. And I look at the clock, I look at the fact or realize the fact that I am not at home with my wife and my child as I should be. And when I left, it was snowing out. And for the first time in a 15-year history of substance abuse, I actually did get in an accident. Later on, everything came to the forefront at work. And at that point, I was out of work. And I've spent my life savings. I said, there are too many signs here for me to ignore this. Everything in my life was not functional. That convinced me to go into treatment.
As a narcotic medication, Suboxone film can cause physical dependence. Suboxone film is available only by prescription. It is illegal to sell or give away your Suboxone film.
Do not take Suboxone film if you are allergic to buprenorphine or naloxone, as serious adverse reactions, including anaphylactic shock, have been reported.
Now I'm involved in a full treatment plan that addresses my dependency on opioids. And it is something that's continuous, and there's no set date on when you're done with it. Suboxone helped me to alleviate some of the withdrawal symptoms and the severity of how bad I was feeling these withdrawal symptoms. And what that did for me was allowed me to focus most of my energy on really participating in support group meetings and my counseling sessions. Understanding that it is a physical change in brain chemistry, in your brain chemicals, helps to really accept it more as a chronic disease, that there is truly a disease process going on in the brain that is changing your behaviors. This can truly happen to anybody, and if you're willing to put in the work, you can get through this.
People who have taken buprenorphine, especially by injection, and in combination with benzodiazepines or other central nervous system depressants, including alcohol, have suffered serious breathing problems and death, and should always be monitored by a physician.
Today, I feel tremendous gratitude. I feel tremendous hopefulness for the future. Through my treatment, especially my counseling, I've been able to not only just identify the emotions, but also learn that it is okay to deal with them. I look forward to seeing my children grow, being able to support their growth, and seeing what type of adults they grow into. I think that's what I'm looking forward to most in life. What I have now is the greatest gift that I probably could have gotten through the process of recovery, and I wouldn't trade that for anything.
Important safety information. Suboxone, buprenorphine and naloxone, sublingual film, C3, is indicated for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and psychosocial support. Treatment should be initiated under the direction of physicians qualified under the Drug Addiction Treatment Act. Do not take Suboxone sublingual film if you are hypersensitive to buprenorphine or naloxone. Suboxone sublingual film can be abused in a manner similar to other opioids, legal or illicit. Suboxone sublingual film contains buprenorphine, an opioid that can cause physical dependence. Chronic use of Suboxone sublingual film can cause physical dependence. Do not stop taking Suboxone sublingual film without talking to your doctor. You could become sick with uncomfortable withdrawal signs and symptoms because your body has become used to this medicine. Suboxone sublingual film can cause serious life-threatening breathing problems, overdose, and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other central nervous system CNS depressants, such as sedatives, tranquilizers, or alcohol. It is extremely dangerous to self-administer non-prescribed benzodiazepines or other CNS depressants while taking Suboxone sublingual film. Liver function should be monitored before and during treatment. Keep Suboxone sublingual film out of the sight and reach of children. Children who take Suboxone sublingual film can have severe, possibly fatal breathing problems. Death has been reported in non-tolerant, non-dependent individuals, especially in the presence of CNS depressants. Do not inject or take Suboxone sublingual film before the effects of opioids, for example, heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, as you may experience withdrawal symptoms. Neonatal withdrawal has been reported. Use of products containing buprenorphine in pregnant women or during breastfeeding should only be considered if the potential benefit justifies the potential risk. Pregnancy is considered an adverse event in patients taking buprenorphine-containing products. All pregnancy exposures should be reported. Caution should be exercised when driving vehicles or operating hazardous machinery, especially during dose adjustments, as patients may experience drowsiness and slow reaction time. Common side effects observed with the sublingual administration of Suboxone sublingual film are numb mouth, sore tongue, redness of the mouth, headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, swelling of the limbs, disturbance of attention, palpitations, and blurred vision. Cytolytic hepatitis, jaundice, and allergic reactions including anaphylactic shock have been reported. This is not a complete list of potential adverse events associated with Suboxone sublingual film. Please see full prescribing information for a complete list. To report an adverse event associated with taking Suboxone sublingual film, please call 1-877-782-6966. You are encouraged to report adverse events of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.